So 2/6 replacement. When was the extraction done?
3 months.
3 months back. Still the socket is not fully filled. It may be filled, but the quality will be little immature. Yes. So we'll measure the mesodistal width. It is around 10 mm. So either we can plan for 1 implant or 2 implant. If you plan for 1 implant, then you may have to go for a delayed loading approach, right? First we will see the cross section. This is the mesial aspect of 6. The length available is from about 9. Okay. You can place up to 10 mm implant. Okay. In the mid socket, we will see the cross section. This is the mid socket. Here the length is 7 mm. That means the sinus is coming very much down in the middle area. Okay. So if you want to place a conventional implant, we can lift the sinus up to 3 mm and place a 10 mm implant and go for delayed loading. We will analyze the distal area. Okay. Distal area also looks good, but the height wise 7 to 8 mm will be. But the good thing is we have got good width. Okay. Since the extraction has been done only 3 months back, it is good. If the patient is coming back after 2 or 3 years, width also will get compromised. So now we are planning for 2 implants, but this is a quite a tough spot, right? Mesodistally only 11 mm is there, 10 to 11 mm. So placing 2 implants will be quite a challenge. We have to select appropriate diameter and design so that inter-implant distance is maintained and abutments we are getting in proper position. So mesial and distal implant. Mesial implant, better to place a compressive implant. Okay. Compressive implant, you can slightly tilt mesially. Okay. So there are 2 options. One is you can place straight, or you can tilt slightly palatally, or you can tilt buccally also. Mesially and slightly buccally, because if you tilt buccally, this where the zygomatic buttress starts, the bone is there very much dense, around 1100 something. So start the drilling from the crest center slightly towards the buccal. You can see. This is one variation of the technique. Or if you want, you can go straight. If you tilt buccally, 1 or 2 mm more height you can get, and good quality bone also. But the abutment will come towards parity. Okay. So the second implant, before second implant, mesial implant, what diameter? Definitely less than 4 is better. Okay, 3.75 you can place. Okay, 3.75 into 10. Okay. And distal implant. Distal implant is better. Basal design, 3.6 diameter. Okay, tilted towards the 7. Okay. You see here we can go a little bit into the sinus, perfect the sinus, not the membrane but the bone. So into the sinus we can go up to 1 to 1.5 mm. So 3.6, 10 mm we can place, right? 3.6, 10 or 12. 10 is enough. Okay. So another challenge what we will be getting is welding. Okay, welding will be a challenge here. Either we can avoid welding, no need to do welding, because both implants will get good stability. But we have to fix it with GAC as soon as possible for splinting effect. Or what we can do is we can select a longer BCS for distal. Say around 14, and use the shank as the abutment. Otherwise, sometimes what happens, this abutment and this abutment, they are very close to each other, they are almost hitting each other. We can select a 3.614 and use the shank as the abutment. That we can do. We will see. Any doubts?
Distal implant sinus operate பண்றோம்னால தான் BCS select பண்றோம்.
Not like that. Initially we have selected a compressive. Distally, if you select basal, the inter-implant bone distance will be good. Because BCS, even if you use 3.6, the proper diameter is only 2.8. The shank, middle part. The threads will allow, the distance between the threads of basal implant will allow good blood supply. Okay.
What if in 3.5 diameter mesial implant?
Yeah, you can use a 3.5, but it is too thin. See, the out of these two implants, the main implant is the mesial implant. Okay, and the distal implant is just a supporting implant. The mesial implant only will get a more bone implant contact, rough surface. 3.5 is very small. We have got good width here, right? Why to use only 3.5? 3.75, here it will be 3.75, but as it goes near the apex, the diameter will be very less. So nothing to worry. Or you can use 4 mm also, but not 4.2.